My name is AKSHITA and I'm a physio here at St Vincent's Hospital. The St Vincent's physios demonstrate compassion through a number of ways to our patients, families as well as visitors. And this is because we go above and beyond to ensure they receive the most outstanding care. And the compassion we show to our patients and our families are extended to each other within our physio department, creating a wonderful culture to work in. There's a large number of people, but everyone's very close and we work really well with each other because we create a lovely team culture within our department, and that's why it works so well.
I initially wanted to start working here as a new graduate because it's a big enough hospital that you get to see lots of different areas and surgical areas, different medical streams, but it's also small enough that you can have the opportunity to rotate through different areas. There's a really close network of physios and multidisciplinary staff, so it's big enough that you get to see everything, but small enough that it feels like a family. As a new graduate, I found it really helpful to be here with the supervision structure that we get. So you're really well supported when you first start with a mentor. We have a transition support role where somebody will be assigned to help you throughout your transition from being a student into a new graduate. And there's lots of support from the senior staff, regardless of what level you are, from the senior grade 1s all the way up to your grade 4s.
St Vincent's has a rich history in caring and supporting for vulnerable patients, those that are culturally and linguistically diverse, and patients who would otherwise not receive access to healthcare. We strive to provide equity to all patients and to create an inclusive environment for all staff across the multidisciplinary team. So after working here for more than 5 years, I really love walking around the hospital and knowing so many familiar faces. From my walk from the office up to the inpatient wards, you'll bump into so many different people. It doesn't matter if you're allied health, support staff, medical, everyone will give you the same friendly greeting no matter who you are.
When I initially started at St Vincent's as a junior physiotherapist, I felt very well supported and I was very well mentored by senior staff. In turn, I have now developed mentoring skills of my own to impart to the junior staff, but I also feel ongoing mentoring occurring daily via my peers. I've had many roles at the Fitzroy campus of St Vincent's Hospital, but more recently I've transferred across to St George's. It's interesting when you change campus, even of the same institution, that things are done differently and you meet lots of different people with different practices. This has been a positive experience and I think it helps to enhance one's learning to embrace the way that things are done in a different place. Also, it's provided quite a bit of experience in other areas such as residential care and other facets of aged care that St George's is involved in.